Welcome to In the Green Room. I'm Kinga.
And this is Owen.
And we are here with Richard Betts.
I'm back.
He's back. And we are here with Candace Stewart. Welcome to the show.
Welcome.
And we are talking about anti-aging and saving the planet by making people happier. Because when you look good, you feel good, and you exude that positivity.
Exactly. And you can, if you feel good, you can help other people and save the planet.
Exactly.
Yeah.
So we're here saving the planet.
Yeah.
One show at a time.
So Candace, we are so excited to pick your brain because some people are believing doing the Botox or the Dysport, and some people like Richard don't.
It's not that I don't believe in it. I don't think it's necessary.
Mm-hmm.
And I don't know, besides the efficacy of it, I'm not sure, what the downsides might be.
Are there any downsides?
The effects.
Yeah, you could have like a slight headache after injection for about an hour. There is where you can drop somebody's brow if you don't go to.
If you don't know what you're doing.
Yeah, but it all wears off at about 3 months. So anything that happens that's bad
Can be
or
fixed.
it can be fixed. So it's relatively safe, and I think. All you're doing is you're preventing the injury to the collagen. So when we contract, you're preventing an injury to the collagen.
Okay.
So when we contract our muscle, make a frown, lift up, it's that constant injury to the collagen that's causing the lines. So when you inject with Botox, Dysport, Xeomin, I think people that are a little bit, want to be cleaner and not as many kind of stuff in their face. Xeomin's better because it's the cleanest of botulism toxin. It doesn't have a carrier protein, which Botox has an egg carrier protein, and Dysport's a milk carrier protein, so it's the kind of cleanest toxin. So when you inject that into the muscle can't contract. So that way you have time for your body, your collagen, your elastin, your fibroblasts are going to create collagen in those lines, because you're not injuring that dermis. So you're pretty much preventing that injury. People try to put a ton of different chemicals and products on their face that I think is worse for them.
Yeah.
Some of which are probably not safe because
Right.
all that stuff gets absorbed into your skin, into your system, systemically, right?
Where the Botox targets that muscle and it's gonna block acetylcholine so you can't contract. So it targets its tissue of choice, which is the muscle, where it's not going to go somewhere it's not supposed to be.
It doesn't become systemic.
Well, we did it to me today.
Yeah.
Oh, really?
Yeah.
I hardly recognize you.
Well, but we don't see.
Yeah.
But we won't see the results for a week.
About 5 to 10 days.
Okay.
So after about 10 days, how it looks will be how it'll look for about 3 to 4 months. So typically people get treated about 3 to 4 times a year. However, so younger population, I know it's a huge craze. Like I'm getting 20-year-old, I want to get my Botox. It's preventative.
This is really important to me that
Preventative.
she doesn't believe in somebody in their early 20s overdoing things. And can you tell us what your company name is?
Okay,
Stella?
Yeah, so the name of my company is called Stella Capri Wellness. I started this 3 years ago. I've been in the anti-aging med spa longevity industry for 10 years. I was the medical director of Beverly Hills Rejuvenation Center before that. And then, once my kids went to school, I was like, I'm going to start my own practice. And I started it was all referral based. And I worked out of a casita out of the side of my house just to see how it go. And I've just grown and grown and grown in 3 years. And now I have a 5 treatment room clinic in Old Town, and it's doing very well. I treat aesthetically in-house, and then I have telehealth clients all over the country. And I also am treating children with autism, and we got approved for a clinical trial for that.
She's helping children. It's
That's
a big
really
deal.
interesting.
And we'll go into that. That's so interesting. So you're helping people,
I am.
you're healing people, and also you're doing something for people that have weight loss issues.
Yeah, so if you've heard of, I'm sure, like the craze of Ozempic, Wegovy, Mounjaro, that type of
You
weight.
see those ads on TV.
Yes. And
Yes.
then you see somebody and they lost a ton of weight, and you're like, what are they doing? So what it is, Ozempic was FDA approved as a diabetic medication. What they found was the diabetic patients were losing a lot of weight, and then it's been FDA approved for weight loss. However, it's so hard to get covered by insurance. Even if you're pre-diabetic, some primary care doctors won't write the prescription for it, and it's not covered. So
And how expensive is?
I think it's about $1,000 to $1,500 a month if it's not covered by
Wow.
insurance.
Wow.
Which I don't understand, because if somebody is overweight and has risk of diabetes, you're put at risk for heart disease, diabetes, cancer, autism, arthritis, the knee. So there's so many things that.
Plus being unhappy, depression.
Right, depression, 100%. So many things where this medication can help and not cost the healthcare system in the future by getting the weight off of people. So, yeah.
Is it really effective?
It is.
In getting weight?
Right. And I've been, in this hormone, longevity, weight loss industry for a long time. And before, the traditional weight loss medications were kind of stimulants, which I don't think are very they're not healthy for the body.
Right.
So this is actually a peptide. And
The Ozempic one is?
they all are.
Okay.
It's called, so the brand is Ozempic. There's Mounjaro, that's a newer class of these type of medications. It's a peptide that blocks ghrelin. Ghrelin is our hunger hormone.
Ghrelin. Okay.
Yeah, so it's called
When your stomach is growling?
It's ghrelin.
Ghrelin. Yeah.
Ghrelin
So
is
it's
ghrelin.
a GLP agonist. That means it blocks ghrelin. So it is a peptide. So the brand name is whatever.
Yeah.
But the medication is called semaglutide.
Okay.
Yeah, Mounjaro one is called tirzepatide.
And there's not really any side effects,
There
negative
is,
ones,
There is a little bit of GI side effects, but
such as?
some nausea. About 24 hours after injecting, a little bit of nausea. Some patients can get diarrhea, constipation, or like a weird tasting burp.
That's not a big deal.
No, and then if you look up the study online, they say, it could cause thyroid cancer. Well, there was not in a human trial. It was a mouse trial. We're not similar to mice, and then they were given I think 1,000 times the dose of that,
Right,
and then
right.
they said, so when people So when patients say, well, I heard it causes thyroid cancer. Well,
Kind of
in a mouse
misinformation,
model, and it was not shown in a human model. But do you know how much you're going to decrease the risk of cancer for patients that lost the weight?
Right.
Show me those numbers.
Well, because it's just extraordinary. I was in your office today in Old Town Scottsdale, and it's you're off of what, Drinkwater and
6th Ave
and 6th Avenue?
Yeah, 6th Avenue, Drinkwater. Stetson.
Old Town Scottsdale area.
Good area.
And one of your receptionists.
Yeah,
Is she a nurse?
She's my manager in laser tech. Yeah.
Okay, Nikki.
Mm-hmm.
It was amazing. She's lost 75 pounds,
Mm-hmm.
and
Wow,
I didn't even
good.
recognize her. She looked so good, and I said, "What happened?"
Yeah.
And she said she took your.
Yep. So she's
medicine.
been So when I saw her, she was very overweight. Because she came in, she wanted to get some aesthetic work, and I said, actually, she used to answer the phones at my last job, and she had got laid off from Farmers and just was in between.
I didn't know that
jobs.
she worked at the other.
Yeah,
facility?
she
Oh,
did.
okay.
Yeah.
Okay.
And I said, I'm kind of drowning over here. I started my one-man shop, but I can't.
Yeah.
I need some help. I said, do you want a job? And
She's great.
Yeah. So she, I think she was 210, and she should be 140.
She's stunning.
Yeah, she is, and it really took a hit on her confidence because she's always been
Course.
pretty and thin, and getting laid off and COVID and all this stuff, she felt pretty hard on herself. And now she lost the weight. She became my manager. She's a laser tech. She also trains trains for AMLA on a lot of the devices. So
Wow.
she's
come a
really,
long way.
yeah.
And I found it interesting. She said that it was her brother that came to her and very politely, sweetly said, because we were having a discussion, because I know somebody that I think needs to lose a little weight. And I said, how do you politely do it? And then she said, well, my brother came to me and said, for health reasons, I think it would, be to your advantage for you to lose a little bit of weight.
Yeah.
And, I can be here for you and support you in any way. And so that kind of triggered her when her brother came to her.
Yeah.
So
well, as we all
in
know,
a nice way, in a loving way.
Yeah, and it is hard even for me to kind of broach this subject for, like, I'm in this industry to help you get healthy, and luckily most of the patients come to me looking to get healthy and lose weight. So, but
they're in that mindset of wanting to get better.
and there is this stigma about the Ozempic, and I'm like, really, this is a longevity medication. I'm not going to prescribe something unless it's going to increase longevity and helps you, feel good, healthier, decrease. So it does that, where a stimulant like a phentermine doesn't. That's not good for your adrenals. It's not good for your cortisol. All you're doing is speeding up your cortisol. It's just not good, and it's not. You're not losing.
Because that's actually aging you, correct?
Yes. Yeah.
Okay. So it's not healthy.
Right.
Here's the elephant in the room. Here's the question. Many people with weight issues go up and down, up and down,
True.
up and down. It's behavioral more than anything else. So
And diet,
how
a lot
do
is
these,
diet,
how do, yeah, well, that's
exercise.
what I'm talking about. Does this drug, something that you would have to take for the rest of your life?
That's a good
Or,
question.
or do you also, do lifestyle choices come into play here as well?
Yeah, 100% both. So, Nikki has been off of that medication for a year.
She said, and she looks
and she
amazing.
hasn't gained the weight back. She did make lifestyle choices. This medication actually does do the work a little bit, but there's a lot of patients that don't. She knew how to eat healthy. Her mom was very healthy. Her mom was a fitness trainer, so she knew what to do. Some patients don't know.
Exactly.
Yeah, right.
I would say that probably most patients don't
So
have that,
yeah, the one thing about that I also like this, so not only is it an appetite suppressant, it tells your body to release insulin slowly from the pancreas. Also, we get insulin resistance with the American diet, with the FDA puts in our food, like just hormone imbalances, inflammation. So there's more insulin that you need on the cell to get the glucose in the cell get the glucose to be used as usable energy. So it's that increased insulin on each cell that's making us become diabetic, insulin resistance. Our body doesn't produce insulin the same. This telling you to release insulin slowly decreases that risk of insulin resistance, and our body starts using that stored fat and burning that and using that as usable energy.
Right.
So then,
so it goes beyond just the appetite suppressant. And then when you come off of it, so as with the pharmaceutical company, their goal is like, I want you to do more and more and more to get to highest dose. Why? If you're losing weight on the lowest dose, why do you have to overstimulate those your GLP receptor, your GLP agonist receptor? Why do you need to do that?
So you're saying take as little as possible?
Take as little that you're still losing weight.
I love that.
So Nikki lost all that weight on like a pretty low dose. That way, when she comes off of it, she's able to maintain that, and her insulin remembered, okay, this is kind of what I did.
So when you put somebody like Nikki or a patient, anybody on this, what diet are you telling them to eat and exercise too?
I'm a big fan of intermittent fasting.
Okay.
I do that.
Intermittent fasting. Okay.
Yeah.
Which for you is, because for some of my friends, they're like,
it could be different for people.
They could do like a whole weekend, or are you saying 12 hours, 16 hours?
So for women, the studies have shown that actually 12 hours is optimal for intermittent fasting. More than that is not. Yeah, you can do a prolonged fasting mimicking diet if you're going through if you have a surgery and you want to activate your stem cells, or cancer, or you just need that activation of the stem cells. But for women it's actually 12 hours. For men it's 16.
Interesting. So 12 hours. So if you have, I'm trying to think, if you have dinner at 6, you're not eating then again till
6 a.m.
6 a.m.
Oh,
you can
so
go
that's not
longer.
a big deal.
Yeah.
Well, it's between when you finish your last meal until when you start.
Yeah.
It would be 12 hours.
Right.
So that doesn't seem really like fasting.
Well, most people
That's not
don't
that.
finish their meal at 6.
Yeah.
Okay. So if you finish
if
at 9,
you're drinking wine, that's going to be.
Oh, that's considered.
That's going to, yeah.
Oh, okay.
Yeah,
Okay.
so that's considered in the
fasting. Okay.
If you're drinking sugar-free, like unsweetened tea, you can't have sugar-free is not good because that still activates your insulin.
So basically, you can only have water.
Well, I drink sport tea. It doesn't activate my insulin.
Tea or water.
Yeah,
In that 12 hours.
Yeah, or coffee.
Okay.
And you can have fat. So you can have anything with fat, but if it has protein or carbs, or even like synthetic sugar type of, even the healthy ones,
Protein,
they're still
so
good.
butter wouldn't work.
Butter would work.
But that has protein, doesn't it?
I think it has a very minuscule amount.
So if you had a glass of wine at midnight, you shouldn't have your first meal until noon.
Yeah.
First of all, you shouldn't have a glass of wine. You should not have any alcohol
Before bed.
3 hours before you go to sleep if you want to have good sleep.
Yeah,
sleep.
you're right.
And food too.
And how do you feel about alcohol or wine when you're trying to anti-age and you're trying to lose weight? You probably should really cut it down.
Yeah, I'm not an I feel like wine and alcohol is toxic to us. I understand with American lifestyle and socialization, and it's, if it makes you feel good to celebrate and have a nice dinner, I don't think you should restrict yourself from anything, but I would say
Moderation.
probably not on a daily basis.
Right.
Yes. I think you're not going to get good sleep, and studies have shown sleep is so important for longevity.
That's for sure.
So, I always wear an Oura ring. It makes me make better decisions.
Me too.
Yeah. So if
What do you mean you wear a ring?
Oura ring.
I don't know what that is.
it's like
it's a
tracks your
ring.
sleep.
It's like a bracelet, but it goes
Yeah.
on. It's a ring, and it tracks your sleep.
And yours is turquoise?
No, this isn't. I'm not
Yeah.
wearing it.
You wear it when
It's
you go to
black.
bed.
You're
I've
pointing
seen
to
you wear
You wear it when you
Okay.
go to bed.
Yeah.
Well, no, you wear it
you wear it
throughout
all
the
day
day.
because it
Yeah, 'cause
tracks
it
your
tracks your
activity
activity.
too. But your
Oh.
sleep, it'll give you exactly how many minutes of REM, how many
Yeah.
minutes of deep, and all this information.
Oh,
Yeah,
interesting.
nap.
and even told me, and so you remember I said I was sick because I had, I was like sick on Friday.
On Friday, she didn't feel good.
And Saturday, and I woke up. I did a bunch of peptides on Saturday. I feel fine on Sunday. I took my kids to the zoo, but it told
Which
me
is so healing to be outside.
It told me I was getting sick, and I was like, I knew it.
Yeah.
Oh, really?
Yeah.
It's tracked you
Yeah.
and told you that?
Well, my body temp was up 0.3.
Yeah.
Wow.
Yeah.
They'll tell you that.
That's
Yeah.
incredible.
And I'm like, so if somebody thinks I'm lying that I was sick, he's like, let me show you my Oura ring.
Now, how long have you had your Oura ring?
I think it said my 3-year anniversary.
Okay, so because they have newer models now, like a year or two after I got mine said they have a brand new model now, which I didn't want to buy another.
Who
one.
invented this and where's it
Yeah.
from?
It's from Scandinavia.
Oura, yeah.
It's not from a certain country that's trying to track what we're doing every minute of the day.
No, it's from
No.
Scandinavia.
I'm not gonna say the
There's
country.
a lot of incredible tech, medical tech coming out of. What country is it? It's not Sweden. It's not Norway.
Does it start with a C?
No. I can't remember.
See, so my temperature was
Oh my goodness.
0.2, 2.6, and 3. Like, I was like, I am never sick.
Oh my gosh, that's so interesting. Wow.
Yeah, but then your sleep score, so you get a sleep score, and like when if I were to drink alcohol, like your HRV is not good.
Oh, yeah.
So this is when I was sick. So HRV, you want it to be very
Wow.
variable. You want your heart rate to be low, and if alcohol can it'll definitely mess up. So I have a sleep score 82, and then what
Really?
your readiness score is. So that means like I'm 88% ready today. If I have a readiness that's not good, which I don't like to look at because I'll know I didn't sleep good or I didn't make a good decision or I ate too late or I might have drank some alcohol. I'm like, oh shoot, I don't want to see my readiness score because I'm not ready
but
for
if
the
you
day.
do drink alcohol with dinner, if you have 3 hours between the time you finish
Yes.
drinking it and go to bed, not an issue.
Right.
And also I want to discuss that if there is, so alcohol in general, if you use it sparingly can be okay, but if you're drinking too much, it's aging you.
Finland,
But
thank you.
also,
Yeah.
how do you feel about these kids that are, in their early 20s or so, and they're either drinking or maybe smoking pot or something, isn't that messing them up because their brains aren't already...
Yeah, I mean, their brain's not fully developed.
Yes.
So, but a younger kid, there's that curious mind of curiosity that they want to experience, you know, the teenager. And so
Yes.
I think now I feel like the younger population doesn't really drink as much. I think they're very, I don't know, like the ones I know from LA or like, you know,
Really?
my brother's friends, they're very they're into biohacking, they're into their health.
Yeah.
They do,
I feel like that's starting to switch into his world.
Okay,
And
that's
even
nice.
my-
Luckily, Owen's all into his health.
That's
He's,
nice.
Yeah,
he's really
so
good.
I don't think
I
that the
don't-
majority of kids.
Well, the reason I'm asking you this is I was
I'd be
somewhere this
interested to know
weekend.
what percentage of kids are,
And-
you know.
Well,
And somebody
I guess
said-
it depends what area.
Yeah.
I met a
isn't-
friend-
Isn't binge drinking still a college sport?
Probably.
Well, so I met
Yeah.
a friend,
Yeah.
and his
Yeah.
kid had to be transferred from a different state to here because he's 19 and he was drinking and smoking cannabis, you know, smoking pot, and something when you're younger like that and you're doing that, he said it turned him schizo, and so he had to be he had to be put into a like a, what do you call it?
Like a
Mental health
yeah.
place, and transferred here, and now he's completely sober and he's doing good.
He's doing good.
But and I've heard that now. I've seen that on TV about different, you know, kids that age, and a few people have told me about incidents where they know people that this have happened to. So I just think it's just in general, like you shouldn't be, you know, younger than like 25 and have any alcohol or.
Yeah, I mean, I don't think you
Cannabis or
should
anything.
have alcohol generally, and
Okay.
with you know, when we're older and can enjoy it with food and do it responsibly. But you know, that I would say to kids, it's like go to college and learn. This is the one time you can just like get as much education as you can and use that time wisely. Don't waste it being hungover or making bad decisions.
Good advice. I love that.
Yeah.
I love that. So what's the number one, when you're telling your clients what to eat, what would you say are the most anti-aging foods?
Okay, so intermittent fasting, but like for women, it's not that hard. But I am a big advocate of protein and veggies, less carbs, less sugar, you know.
Yeah.
Keto, as far as fat, I think good healthy fats, avocado, coconut butter, olive oil. Yes, you need them. Nuts are important. Do I think somebody should go strictly keto because then you could be potentially fasting? No.
Why?
Because for some people that need to lose weight, that might be the diet for them, and it's dependent on their SNP, which is a different amino acid in their DNA.
Because everyone's different.
A different base pair. Yeah, a
everyone's
different base pair.
Everyone's
so everybody's
different.
And you can take a test. And for me, when I tried to do keto, I just didn't feel good. I gained weight. I felt inflammatory.
Really?
It was inflammatory to me.
Yeah, which is
Interesting.
you know, it's not.
Yes.
It's,
So to tell somebody exactly what to eat, you need to listen to your body, because the keto did not work for me. And then when I took that SNP test, that wasn't the diet for me.
what's the
That
test?
I don't know. I've never heard of that.
There's like different SNPs you can look at.
Sniff?
SNP.
SNP.
Yeah.
What's that an
Single
acronym for?
nucleotide
Oh.
protein. Yeah.
Okay.
I feel
does
that's
it
good,
stand-
that's good to do though, because in
Yeah.
today's like day and age, everybody just looks on the internet and
Yeah.
they look up how to lose weight, and they'll find this one way, and it's not what they need for their body. So getting that test is super important to
Yeah.
know what you need to do.
Yeah,
But
everybody
you
has
also
different
know
allergies and
that,
everything.
like, you'll know it like, I knew that. I didn't necessarily, it just proved to me. Same with, that was the same SNP test with the cannabis. I knew that I did not like it. It makes me feel paranoid. So that said, the SNP said more likely to have paranoid if you smoke marijuana.
Really? It tells you
Yeah.
that?
That's really
Interesting.
Oh.
I've never
Yeah.
heard of it, so
I don't
that's,
know
it's
that.
I
educating
need to.
me, so yeah.
Yeah.
It needs to be more.
So this was through Wild Health, but I am gonna offer this. I just need to find the right company I want to use to do that diagnostic.
That's such a
test.
great idea.
Yeah.
I bet I could get this test. You know, I go to a medical practice that practices functional medicine.
Yeah, so
I could get a
Well, that's
SNP
what she
test
does
from
too.
them.
Well, it depends what. It's not really the SNP. It depends what company is gonna process it. It's
Oh,
an
of course.
algorithm.
Yeah.
So where I got my fellowship was Wild Health, so I was using them for my patients, but I finished that, like, you know, I finished that certification, so I don't, or the fellowship, so I don't use them anymore. And I think to pay them to process it is very expensive for my patients, so that's why I need to find another company. But yeah, I just,
So something very
Very
important that you mentioned several times today when I was at your office, that it's so important for people to get their blood work done. Can you tell us why?
yeah, I mean, 100 ways. It's important. So,
Sure.
you know, with primary care and seeing the doctor, things have definitely changed. Like, it's hard. I have so many people that move from out of state. They're like, "Do you recommend a primary care physician?" And I'm like, I don't. So I do have a concierge medicine practice where I'm kind of your primary care. I don't do diagnostic tests if you have to, you know, so you still kind of need somebody to go to. But if you're sick and you want to come in, and I manage a lot with peptides, putting the labs in, but labs are so important. With peptides, there's some things you can monitor with the labs, but they're safe for anybody. So, you know, with semaglutide, the only contraindication is type 1 diabetic, and then history of pancreatitis. So I want to kind of see that in the labs first and look at their pancreatic enzymes and liver enzymes before I put them on semaglutide.
So is that the only, you only look for that? Or is there anything else that you're
look
like,
at their
maybe they shouldn't have
insulin
it?
and their glucose. I mean, no.
Okay.
If they have bad labs, they probably need it.
Okay.
You know, like high inflammation, high cholesterol. It's going to help your cholesterol. It's going to help your inflammatory markers. I have so many patients' labs that have like been so much better after being on semaglutide, just by managing. So the thing with the diet and the semaglutide is, so yes, more protein, veggies, and healthy fats, decreasing the carbs, decreasing refined foods, just, you know,
Yeah.
Decreasing the alcohol.
decreasing the alcohol. Yeah.
How about
so
coffee?
And when it comes to alcohol,
Coffee, I love coffee.
Coffee's
Coffee's a
good?
nootropic. So people
Okay.
try to say, like, I want to stop drinking coffee. Well, why? It's stimulating your brain to do good things.
Oh,
You know,
okay.
nicotine's a nootropic too. Smoking it is going to cause cancer, but you can take nicotine in a way that can stimulate your brain. Some people use it when they're writing
Exactly.
Okay, well, I see a lot of kids puffing on those little.
Those are horrible for you.
Terrible.
Way
Yeah.
worse than cigarettes,
Worse
probably.
than cigarettes, yes.
It's so terrible.
It's so terrible. And I think they're so addicting, and yeah, they need to, like,
I have a
why
friend,
won't
I'm not
the
going to shout it
FDA
out right now,
ban
but
that?
she's got it in her mouth 24/7.
I know, so FDA banned a bunch of peptides, but why aren't you banning the vapes? Like, what the heck?
I know.
Yeah.
You can't count on the FDA
I
to
know,
have your
it's
best
like-
interests at heart. I'm sorry.
Right,
That's
I'm
the
Oh, I don't want this.
reality.
I don't want this canceled.
Okay,
so
fine,
let's watch
okay.
what we say here.
Uh-oh, they're knocking on the door.
Yeah, well,
Just
can you
sending
please
people
So-
ban the vapes? I think they're doing, in California, I think they are making some changes.
Well,
Yeah,
it's hard-
they've banned a lot
Yeah.
of.
It's hard to believe that
companies,
kids, teenagers, are all walking around puffing on that stuff. How are they allowed to do that? It's unhealthy.
I know, well, they're addicted, and they just,
So what do you recommend for a parent? Because you have younger kids.
yeah,
If you have kids that are doing that. Luckily, my kids are not doing that.
yeah.
That's good.
I mean, I'll be there soon. I have a 8 and a 9-year-old.
If all of a sudden your
and
kid was doing that, what would you do?
I would, like, I would take away any source of income that he could buy it.
I love that.
That's smart, that's smart.
And homeschool him.
Yeah.
Ostracize.
So if he can't buy it, I mean,
But what if he's getting it from his girlfriend?
Kids have ways.
yeah, they do.
Yeah.
You know, I grew up very, pretty poor, and so I think a lot of the times I couldn't get in trouble because I couldn't afford to do anything.
Well, that's the thing is,
Yes.
I mean, my sister and I,
This is a big factor.
Yeah, I couldn't afford
We weren't
alcohol.
allowed
I
to do
couldn't
any of that
afford
stuff.
Yeah.
drugs, so
I know
I
your
don't
mom
think I
likes to
would.
talk about how we would go out,
Yeah.
but we didn't start going out until we were like 17.
No, she has some stories that but I don't know if they're all like, I don't know if the whole story's true, but she
No.
likes to tell her fables.
They're fables because we weren't allowed to do anything. So yeah, we were pretty good until about 18, but then we were still good. I mean, because we were brainwashed about health and alcohol and
Grandpa was
nicotine
very
and all that.
against it.
Oh yeah, he was always showing us pictures.
Yeah, and my dad was like a gymnast and very health conscious. So I think I always kind of
Great, well,
but my brother, he's very health conscious now. He's great, but when
Younger
he
or
was
older?
Younger, he's 2 years
Okay.
younger, so I go to Burning Man with.
Oh, that's right, Burning Man. She went to Burning Man.
So,
Very sustainable.
but in school he was really bad and smoking a lot of pot and but he doesn't drink any alcohol. He's all about the peptides and
He's all about the peptides.
yeah,
I love
let me
it.
show you.
This sounds like a good trend.
Yeah, it is.
It is. So after you take the peptides, do you have a positive like euphoria about you? Do you feel that you've taken them?
So much enough that they get you high.
You're
Positive
right.
euphoria.
Do they make you feel good?
I think it's a whole mindset, right? Like
Yeah.
you have this routine usually.
Placebo
So
in a way.
the semaglutide you only do once a week, but the peptides for inflammation you do daily. And it's like, I'm spending this money on this peptides. I got to do this routine. I come up with a whole protocol for my patient on what to do. As far as supplements and peptides and hormones and whatever else that I think that can help them in their health journey. And it's like, okay, they sought me out to get healthy. It's their responsibility. They have to take an accountability of their health, and I think injecting the peptides and doing that daily is like, okay, they make better decisions their day, or if they get the Aura Ring, or even take some supplements, or just knowing to like drink enough water throughout the day. It's it can be baby steps for some people. And
There's
then
a lot
with
of different ways you can be healthy.
Well, just the fact that she did all that. What did you eat today on me?
Dysport.
Dysport. Like I already feel better.
Yeah.
Psychologically.
Wait, so how does that process go? Like, explain how the process goes for what you did for her.
The Dysport.
Oh, well, for the Dysport, so, we just, and it took like 5 minutes.
Yeah,
I
it
think.
did. It
Yeah.
took about 5 minutes.
So
Well, she has your office is beautiful, by the
thank
way,
you.
and it's all whited out and very feminine and just
Yeah.
it feels very relaxing. Like you
Yeah.
feel like you just want to chill and
That's good.
and very clean, but you're very very sterile,
Yeah.
so it's very safe.
Mm-hmm.
That's good.
But you tell, I don't know what you do.
Yeah, so if I have a hormone or peptide patient, usually we'll get labs.
Mhm.
They fill out a consult form, and then the labs are like 13 vials of blood. So it's a lot.
13?
That's pretty
And then
Wow.
comprehensive,
yeah, because I
In,
really
in one
want,
sitting, you do 13
Well,
bottles?
when they get their from the lab.
I'm confused. So you sit there and they take
No,
13?
I
No,
send
they go
the
to a
lab.
blood lab.
They go to a blood lab, like Northwest. Or
Right,
like,
right.
Yeah.
But then that lab takes 13 vials out?
Yeah.
Wow.
Yeah.
So you lose
Good
weight
timing.
immediately.
Good timing.
So it's a very
That's the way to think about
comprehensive.
it.
And then they fill out the paperwork of like what I need to assess, because there's some things that only clinically I can help with the peptides. I'm not going to see it in a lab. And then I come up with a protocol and we get the peptides ordered and the hormones ordered. So that's something. But then for the stag patients, like for my new patients, I usually have a consult and come up with a plan. And, I love to do more natural approaches. I think, we want to age gracefully, but we want to still look like ourselves and not
I love that.
somebody
And
else.
that's why I
Well,
sought her out, because I knew that she was the best. Because
Okay,
our mutual
yeah.
friend Blake,
Yeah.
he said to me, he ran the Beverly Hills
Yeah,
Rejuvenation
he did,
Center,
yeah.
and I said to him, well, if I ever do any of that poking on my head to look young, who would I go to? Who's the best? And he said, you were.
Yeah. Well, I'm a big nerd, and I look at,
Great.
I go to a bunch of
That's
conferences and
important.
do a bunch
That's
of
important,
trainings,
yeah.
and that's kind of why. And
But I love
I'm
that
not-
you're not aggressive about it. You're,
No, I'm not gonna sell you something that I don't think is gonna be beneficial for you. And with this industry, there is sales to it,
Mhm.
but
You're not that way.
No,
I
She's
feel
not
like
that
that
way.
scares a lot of people away.
Physically be that
There
Because
way.
they feel like-
practitioners
They
that
feel
are
like
not
you're just gonna
as
try to sell them
enlightened.
anything.
Right.
But
She
if
is.
it's the right person you're going to, they're just trying to make you feel and look better. So
Yeah.
you just have to find the right person to go to.
And we talked about it earlier today that everybody out there has seen somebody that looks like strange because
Yes.
they've overdone.
Their face is like a mask. There's no expression. It's
Yeah.
like they're frozen to
Or
one
they're all-
expression. Like
or all the
they're
fillers are all
Right,
puffed
right.
up, and you can
Yeah.
see where
Yeah.
it looks unnatural here,
Yeah.
or it just doesn't look good.
Right, and it makes you look older, and then you
Exactly.
spend all this money to
And
look
fake.
older. And it's like, what
And
was
you would
it?
think so. It's nice when it's just
Yeah.
very subtle.
So I do a lot of more same with like, with the peptides is that we're biostimulatory, where something's going to stimulate your own collagen, your own elastin. They're not going to change or distort your face. It's just going to kind of help with thicken the dermis or rejuvenate some of the fat cells that you lost as we age, because that's what happens as we age. We lose fat and collagen out of our face. We have 2 fat pads. One's deep, one's superficial. The deep one loses fat, and the superficial slides down our face.
So what can we do for dark circles? I think you did something recently that.
Oh yeah, so
for-
I did. So I used my own platelet-rich plasma, and I had Alex, one of my great injectors. I just did this on Friday, so it's still a little swollen. Injected it like you would kind of a filler, but it's just my own platelet-rich
It's
plasma.
her own blood.
My
Yeah,
own
yeah.
blood, and
Mhm.
we heat it up so it becomes like a gel.
Okay.
So it's a little puffy for a couple days, and then it has growth factors and signaling, and then it's gonna just increase the collagen.
Which is going to be more
Super
useful.
cool, yeah.
Yeah, but it's natural. It's just my own.
Totally natural.
Yeah.
So there's no side effects to that one.
No, and you can inject you can inject it all over the face. I have a lot of models from LA, and I don't ever want to change their face. They're models
Yeah.
for some reason, and either their management. So I do a ton of PRP gel for models.
Super.
Okay, so
Yeah.
then.
And for the normal because everybody wants to look like themselves. And it doesn't draw water in, where the HA filler draws water in, can make people look puffy. There is places for HA filler, just I think there's.
Rachel had a
things.
question, and
Yeah.
you guys keep talking, ask her
So
questions because I want to call Rachel.
collagen. Now,
She had a
the
question.
body produces collagen. It's
Mhm.
part of your body.
Mm-hmm.
I take collagen
You do?
as a supplement.
Yeah, you're kind of wasting money.
You think so?
Yeah, how are you
I-
gonna make collagen when you absorb it when you
It's
eat
a protein.
it? I know, but how is it gonna signal in your body to produce more collagen when you just take it orally?
Well, there's I've read a lot of benefits of taking
Yeah.
collagen, and not just any type of, but the 5 different types of collagen.
Yeah.
A complete protein, and I've
Yeah,
You
so
know?
to stimulate, I think it's a waste of money. I know collagen, the vital peptides sold for a lot of money, but you're just you're taking it orally. It's not gonna it's not gonna transmit into signaling to the body. So for collagen, there is to stimulate collagen as far as peptide, I like GHK copper. So what that peptide does is, so we lose copper peptide as we age, and then that decreases collagen. When you infuse the collagen peptide with the GHK copper peptide, it increases the collagen production of collagen, and you can do that as a cream or injection, where you're actually signaling you're increasing copper, and then you're increasing the collagen, because loss of collagen is loss of copper too. Where just taking collagen, I don't see it going
It's not
to your
targeting
face. Like it's not
well,
targeting anything.
I think collagen has other
I think
benefits.
I think the powder.
Nutritionally, I think
Yeah,
yes, that's what
right.
I'm talking. I'm not taking it to erase lines in my
Right,
face.
but I know a lot of people spend money on that, thinking that they're going
No, that's not what I
increase
think.
the thickness of their dermis. I do think the Vital Proteins has good fat in it and other if that's where you get your kind of nutrition, your supplement, you're getting a good source.
Yeah.
Yeah, would I spend the money on the Vital Proteins collagen powder? No.
Interesting.
You can get, I mean, I'm a big advocate of AG1. I'm busy, I'm working all the time, and patients back to back. I don't even, and my husband has a new food nutrition company. It's called Sunfair, which I put a lot of people on semaglutide on this diet too, and teaches them how to eat, because all the food's prepared, and it's based on, you know, there's a little fat, a little protein, a little bit of carbs, just tiny about, but it's based on what they're kind of.
And isn't it the portions important?
Yes, the portions.
Portions are so
and
important.
They ask you what's your height and weight, and it's all these macro, and it's all this,
personalized.
yes, personalized, and there's.
It's a genius idea.
It is. He
How long
started
ago was it started?
27 years ago in LA.
27 years ago.
Yeah.
He was before his time.
Yeah, and there's a
Wow.
lot of anti-aging functional medicine doctors in LA putting
Sure.
people on semaglutide that they do so much better when they're on the diet plan.
So I have a couple friends that should be on that, and
Yeah.
we'll talk about that later.
What is that company
So-
called?
Sunfair.
Sunfair?
Mhm.
How did you?
SUNFARE.
Well, let's do a whole show on. Let's get your husband on here and let's do a whole show on that.
I know.
Yeah, we really need to
it's
do
a really
that.
cool story.
How did you
how it
guys meet?
started.
I know
Oh, yeah,
it was
that's
like
good, that's
somebody
good.
set you up.
Yeah, so when I
Your assistant or
no, his publicist, because he has a lot of celebrities are on the Sunfair diet in LA, and his assistant moved here at the same time, or somehow I started a book club with his assistant, not his assistant, his PR
Publicist.
publicist, yeah.
Gotcha.
And then I got divorced, and I was going to move back to Philly be with my family.
Thank God you got divorced.
Yeah. And then
Next.
so when I was getting divorced, my PR Jen was like, I need to set you up with John sooner. I'm moving. I'm not looking to date. And but I was working. I had a good job here. I was working at Mayo Clinic. I was a hematology oncology nurse, and then I was getting my doctorate from ASU, and Mayo's like paying for it.
Wow.
I had transferred to Penn.
Oh, yeah, she's a big deal. She knows her stuff.
Yeah, and
She's
I
smart.
She seems very.
Yeah.
so I transferred to Penn and was like, I'm just gonna be a working professional. But I was like, all right, I'll go on a date. Well, I didn't want to initially. My dad's like, what are you gonna do? Stare at the wall? I'm like, no, fine, I'll go.
How cute. He encouraged you. I love that. And then what happened?
Then we went on one date, and it was great. He's a really good person and just different than what I was used to. And I was like, you know what? So my dad came out to actually move me back to Philly and help me pack up all the stuff and drive the dogs back, because I had like a big Doberman and I couldn't fly with it. And then my dad flies out, and he's like, sees John just around, my husband, and he's like, you're not moving back, are you? Like, nah.
But wait, he saw him?
Yeah, like, because John was just always around. Like, he came out
Uh-huh.
to move me, but I didn't tell him I wasn't moving yet, because I wanted him to still come out and visit.
How cute.
So I was going to tell him once he was out there.
Oh, by the way.
Yeah,
By the way,
we don't need to drive
moving
back.
back.
we don't need to. I'm staying.
That's sweet.
Kind of worked out.
That says a lot.
Yeah, and then we
You
had,
hear about it.
we got married within a year and had kids right away. So, but his story of starting Sunfair, he started it with $500 on a credit card, and it's just crazy the celebrities that have been on it, and it's pretty remarkable.
really
He was
successful.
like one of the first people in this industry to start that personalized meals and delivery. And the difference with their company is so the reason they're only in LA and Phoenix, they deliver your food fresh to your doorstep every night.
That's important.
So you just heat it up, whether it be air fryer,
Wow.
microwave. So my kids have always eaten.
Sounds expensive.
It's
How much is it a month?
It's $40 a day if you get breakfast, lunch, and dinner.
Okay.
Which, I mean,
That's not bad at all.
And
That's not bad.
For 3 meals?
What?
At a
yeah,
restaurant, that's like.
But how does that fit into
So
your
there's somebody I
intermittent
wanted to
fasting,
send.
though?
yeah, they have an intermittent fasting, so
Okay.
you don't get
Oh.
breakfast.
Yeah.
So they have a couple different diets. A fat burn one. If somebody doesn't want to do the semaglutide, rather they just want to try it diet wise on themselves, they have this fat burn diet, and people lose 1 pound a day, and it does suit the same thing as the semaglutide that resets your basal metabolic weight, because no matter what we do, sometimes we're just set at this weight. Diet, exercise, or
Right.
insulin's like, I feel comfortable at this weight, I'm going to keep this fat, and
You're kinda
this is-
stuck.
I'm going to hibernate with it, whatever. So
Right. Let's all hibernate.
Yeah. Which we're like, we're not doing that. We're not like, whatever. We don't live caveman years where we had to forge and whatever.
Yeah.
Yeah.
So, this diet, it's like no fat. So it's just
Oh
protein.
wait, it is no fat.
No fat. So
Okay.
this, because you want your body to use its own fat.
Not even healthy fats.
No.
Interesting.
And it's kind of like the HCG diet. So without the HCG. Because you actually don't need the HCG.
And there's no sugar.
No, very minimal. There's a little bit. Like you'll get 2 fruits.
Can you have wine?
No.
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 Those are for you.
I'm out.
No wine.
I'm just
Yeah.
kidding, actually. No,
And you actually can't work out because then you'll start breaking down muscle instead of burning fat.
Oh,
You
you
can't work
can't
out
work
either?
out?
You can do like a light work,
Okay.
like a light walk, but
You can't,
nothing
like,
really
heavy
like
weight, yeah.
anabolic. So that's like the struggle for people there. I want to work out. Well, you know what? You could do some yoga. Just like take it easy. Because sometimes working out can cause a little too much inflammation. You won't lose the weight.
Yeah.
So this is, it's
Okay,
the
well,
food
I'm
is
gonna
good.
hold on. I don't think it's ever good. I mean, my dad was a cardiologist to not exercise.
Well,
Or
she's not saying that.
recommend-
Is this
she's
for
not
2
saying that.
weeks?
Yeah, I mean, you
Or is
lose
this-
like a pound a day.
I think you're misinterpreting what she's saying. She's saying you're not supposed to heavy lift and break down your muscle.
break down your muscle.
Because then your body is focused on building back muscle instead of losing the
Mhm.
fat and weight.
Okay.
But like you can go, you can go for like a run. You can
a light.
Yoga would be good.
You can still exercise.
You
You
can
just
still
can't.
exercise, just you don't want to like do it
Over-
heavy.
Exertion.
Yeah, and
Not
you
break
only
down muscle,
do this. You do this till you're at the weight you're happy at,
Okay.
right? And then you go to intermittent fasting. Then you want to work out.
But then let's say you do that, you lose the weight. Are you going to put it right back on?
No.
Wow.
Yeah.
Okay. Because that's
then people go to intermittent fasting, which has some fat and some carbs.
Oh, I love my
and-
fats.
Yeah.
Yeah.
Okay,
grass-fed
so we think
butter.
Yeah, I know. Kerrygold is really good.
so we have
Very good
about
butter.
9 minutes left.
Okay.
What would you say if somebody was going to go on this diet? Let's say, like, I kind of want to just lose like 10 pounds.
Mm-hmm.
Is that a good diet for me?
Yes.
It is. Okay.
Yes.
Okay.
And you'd probably just do 10 days to 2 weeks.
Okay.
I mean, it's a little hardcore because you can't have a social life. Can't drink wine. If you're going out you can't go to a restaurant. You got to eat this food.
Yeah, yeah.
Yeah.
So that's why typically people
Oh.
do 7 to 10 days.
Yeah, this is a
Okay.
It's like
wasn't
you have to be
thinking about
very
committed to it.
strict
Yeah.
program.
Yeah.
Oh, okay. So if I know somebody that needs to lose a lot of weight,
Uh-huh.
is this a good program for them?
Well, I think yes, because I think with semaglutide, a lot of weight, they should do semaglutide with it. That's what else semaglutide has been good for is it actually plays on dopamine. So a lot of times with food addiction or gambling addiction, you get that dopamine hit. Like you weren't looking for, like, I want that chocolate, I want that wine,
Sure.
So it actually changes the way we feel about like the release of dopamine you get when you gamble. It doesn't give you that same high.
Yeah.
It doesn't give you the same high from food. It doesn't give you the same high from drinking wine. So they find that I feel like this medication, when somebody and I'll ask them in my assessment, do you feel like your issues, do you eat healthy or do you feel like it's kind of like a food addiction? Do you overeat at times? Then there's something else going on. If it's the overeating, well, I think semaglutide is probably going to be really well for you. You need to learn how to eat. But somebody that eats, I have so many people that generally eat pretty healthy. They intermittent fast. They fill food prep, and they're just not losing the weight. And that could be, genetically they're predisposed for polycystic ovarian. They have insulin resistance. There's the environment or maybe some illness kind of messed up their insulin receptors. Where the semaglutide is going to fix this. It even helps so many women with polycystic ovarian, which is awesome.
All those factors that you just listed, can you get? All those factors that you just listed, can you get the results from the test that you're talking about? The
SNP, like testing
the
SNPs.
Yeah. Can you get
Good question.
like what you have from that or no?
Yeah, I mean, it can. I would want to see a blood test too, but it would help me like more customize a diet. However, the semaglutide does it for you because you just don't crave things that are bad for you. And seeing with the workout, it does, like, what type of workout is better? Like, is it, high intensity or is it more? And I get really sore if I do high intensity. I get more inflammation. So mine is like low intensity.
Everybody's different. Yeah, you just have to find what you have.
I know
So,
that,
yeah.
but you're
Some
still
people,
at this. But what makes you feel better? Is it going for a long run? That might not be beneficial. It's kind of like You gotta weigh
Yeah.
your.
You have to know the factors.
Yeah, or like, well, this makes me feel so good, so I feel good when I do this. I know it might be a little bit inflammatory. Same with like somebody drinking. Like, I feel it helps me relax. I want to drink. Yeah, it's probably not good for you, but you know, we have to live our life and be happy and make the world a better place. So, you know, I think everything's kind of a balance.
Absolutely.
Well, we did a show not
Very
too long
true.
ago with a doctor that actually smoked cigars for relaxation, and we basically did a show about, you know, how there are so many of these doctors that are doing this, and it's not like a daily thing, but they do it quite often. But it makes them relax. They're able to like escape from their wives and you know, just have like a break. They don't have a honey do this, honey do that, and they all feel like it does anti-age them, even though it's not good for you.
Right, and there is a point. There's going to be like decreasing your cortisol, decreasing your stress levels.
Yes.
If there's something that might, you know, you have to find the balance of what is worth it. For me, having a glass of wine before bed and messing up my Oura ring, not worth it.
Priorities.
I don't get
She has
I
the
don't
priorities
get
in check.
I don't get enough happiness from a glass
Why
of
would
wine.
you have a glass of wine before bed?
No one does
Well,
that.
like,
People do
well,
it
if I
because they
don't-
want to relax, but then what
Yeah.
happens is they wake up in the middle of the night
Yeah.
when you have alcohol
Yeah.
right
And
now,
the next
you're
day
not-
you just feel
Yeah.
terrible.
So
So
it
you
ruins
should
your
like
sleep.
really just meditate.
So let's
one-
recap. We have 5 minutes left.
Mm-hmm.
If people want to find you
Mm-hmm.
and get all anti-age and slender and
Yeah.
real happy
Feeling their
again.
best self.
We didn't
Best
talk
selves.
about a lot of the important things about anti-aging, like telomeres,
Oh yes.
mitochondria,
Mitochondria.
autophagy.
Yes.
These are whole other areas that
I know.
you know we could explore
And
another
also
time.
stress.
Perhaps,
Yeah.
right?
Stress kills.
Yeah, stress, lack of sleep,
Yeah.
but yeah, there's
And microbiome.
right, 100%. You need a healthy gut. You need our mitochondria loses its efficacy as it ages. We need to increase our mitochondrial energy, and there's ways to do that. You can do it with peptides. You can do it with sauna, cold plunge. You can do it, you know, with intermittent fasting or prolonged fasting. So there's things you can do that cost money, and there's things you can do that don't.
But this is a big part of the
Yeah.
anti-aging movement.
Right.
Yeah.
And how do
Yeah.
you feel about the gut? I mean, do you feel
Oh
like
yeah,
our
yeah.
gut
I
health
mean,
is
yeah,
anti-aging if we do stuff for our gut?
yeah. If you have an inflamed gut, you have an inflamed
Yeah.
Everything.
everything.
And
So
you know
need
what
to
the
heal
most
gut.
common condition is called SIBO.
Yep. So and SIBO is really hard to get rid of. So there's a peptide. It's called BPC 157 with KPB. It cures SIBO.
So on our next show,
And
we
I
want
have
to
to
talk
help
about.
a lot of my autistic patients.
That's what I want to talk about for our next show.
their
Can you kind of
guts,
give us a little
their-
teaser?
Yeah. So I have to heal their gut and heal their inflammation if I want
That's
to heal
what
their
I'm working
brain.
on now. I'm personally working on restoring my microbiome.
Oh yeah,
to
so
balance,
you
yeah.
the BPC KPV, and you only have to do that for 30, 60 days, and then it's healed. It's not something you stay on for life.
So when you do it for 30 to 60
bring
days,
this
are
up
we
to
doing this
my-
every day?
To
They
my
probably-
practitioners.
Is this something you do every day, once
It
a
is
week?
one pill. It's a pill.
One pill a day?
On an
Interesting.
stomach. Yeah.
Okay, so if somebody, like, let's say Richard was going to do this
Uh-huh.
biopeptides for, what did you say, 60 days?
30. Yeah, if you have SIBO, I would do 60.
Okay, so if you do 60, what would that cost? For your patient that comes in. Like approximately?
I think it's $4 a pill. So
No, that's not bad.
60.
I would do
$2.40.
that.
Yeah.
Yeah, so that sounds like you need it too.
And the BPC is healthy in other ways. It's, you know, I call it the Wolverine peptide. It kind of it heals your ligaments and joints. I do a lot of injections with it for people that have, torn ligaments or if they're trying to avoid a surgery. But it's great for gut.
For people that are listening,
Oh yeah.
For people that are listening, what benefits do you get from having a healthy microbiome?
Good question.
Yeah. Well, I think
That's
a lot.
long discussion.
Yeah.
That's
I
long.
know.
Yeah. Well, just like
So,
in
yeah,
simplest
yes.
terms. In simplest terms, like, does it make you feel
Dumb it
better?
down.
Does it make you like
Yeah,
look
well,
better?
you know, having a healthy microbiome, if you don't have that,
Yeah.
like what it can cause. Like some kids can get pandas, which is this crazy inflammatory response, and be a totally different kid. It can cause IBS, inflammation in the gut. I don't know how you feel when your gut's inflamed or having constipation, diarrhea.
Cause depression.
Yeah.
All
Yeah.
kinds.
So if someone's
it affects your entire system, your whole everything.
Yeah, and even your brain,
health,
your
yeah.
cognition.
That's right.
So can that be
And then
a
it can
sign?
also cause inflammation, and then it can also make it messes up your immune system, where you can't fight off normal bacteria and viruses.
So can that be a sign that somebody doesn't have a good gut health if they are having chronic diarrhea or often having it? Oh, okay,
And
interesting.
fatigue.
Yeah,
And fatigue.
yeah.
So what
And
one
it
food
can
can you
mess up
recommend
all your
for?
hormones too. It can decrease your thyroid function and
1 minute left. What
Uh-huh.
one food can you recommend for your gut health? What like yogurt or
no 'cause
kombucha?
No, that sugar yogurt.
None of the above.
Come to Stella Wellness.
It would be a peptide.
Come to Stella Wellness.
Yeah.
Okay, to be continued. We have so much more to talk about.
Magic pill
Thank
for
you
a lot
so
of this
much.
Stuff, right?
Thank you, Stella, for coming.
Saving
Saving
the
the
planet,
planet,
one show at a time.